Welcome to the DPS Infection Control and PPE Competencies Review. In this training, we'll review how to prevent healthcare-associated infections and apply PPE safely and effectively. By the end of this session, you'll be able to understand the importance of infection control, differentiate between standard and transmission-based precautions, demonstrate correct PPE donning and doffing, and apply CDC and Joint Commission recommendations in clinical practice. Standard precautions apply to all patients, regardless of infection status. Always perform hand hygiene before and after contact. Use gloves, gown, and mask as needed. And handle all patient equipment carefully. Use contact precautions for infections spread by touch, such as MRSA or C. Difficile. Wear gloves and gown before entering the room. And remove them before leaving. Use dedicated or disposable equipment when possible. Droplet precautions protect against infections spread by large respiratory droplets, such as influenza or pertussis. Perform hand hygiene and wear a surgical mask before entering the room. Remove the mask before exiting. Airborne precautions prevent infections like tuberculosis, measles, and chickenpox. Wear a fit-tested N95 respirator or higher-level mask. Keep the door closed, and remove the respirator outside the room after use. The correct order for donning PPE is: first, perform hand hygiene, then gown, mask or respirator, goggles or face shield, and finally gloves. Always cover gown cuffs with your gloves. To safely remove PPE, follow this sequence. Remove gloves first, then gown, perform hand hygiene. Remove goggles or face shield, then mask or respirator. And finally, wash your hands again. Avoid these common mistakes: touching your face or adjusting PPE during care, wearing the same gown or gloves for multiple patients, skipping hand hygiene between steps, or removing respirators incorrectly. Standard precautions protect everyone. Transmission-based precautions contact, droplet, and airborne add extra protection. Proper PPE use and hand hygiene remain the most effective ways to prevent infection. This training is based on CDC guidelines for isolation precautions and the Joint Commission's 2024 infection control standards. Continue to practice safely and protect those under your care.